I've always been all for a diverse background because someone gave me a chance, and so I always have my mind open to that diverse background. I mean, I actually at one point hired a vet, someone who had a veterinary background. Um, uh, so I am all for that diverse background. And as a matter of fact, as an infection prevention leader, I try to emphasize that. Sorry, with the team, saying when I have the team at the table in a room meeting, there are certain times when I want to emphasize that they all bring something important to the table. So if you have a very clinical background, or you have a master's in public health background, or a clinical laboratory background, or a pharmacy background, you are all bringing very important talents and skills to the table. And together we're stronger. So for me, to answer your question about what would be the ideal team, I think having people who are good with data, with stats. So maybe your MPHs are at the table. Certainly clinical individuals, nurses, respiratory therapists, certainly the laboratory individual to help us with all those kind of diagnostic things. And the one thing that I played around with in my system director role, but I never really got to do, was to see about a pharmacist, because I think having that antimicrobial stewardship piece would also be an interesting IP on the team. I mean, certainly we interact with antimicrobial stewardship pharmacists, but it would be interesting maybe to have them right there on the team. And then who else would I add? Well, I mean, I think we want people also who are able to project manage, things like that. So maybe if you have the resources to have someone who's a non-IP, but can help IPs do the work through quality work, or project management, that would also be somebody I would add.